My name is Mandy Iverson, and I'm going to talk to you today about antibiotics and the proper use of them. And I have a handout for everyone that you can kind of follow along. It's not really, and I printed this off from the CDC's website. And basically, I'm sure everyone has taken an antibiotic at some point in their life for various things. And the problem that we run into is that being nurses, which most of us are in this room, or in healthcare, we know the proper policy that you're supposed to finish them off and take them for the total prescribed time. Don't skip doses. But I can almost guarantee that every one of us has not followed through with that for one reason or another. After we felt better a couple days, we've stopped them, said I don't need that, or we've forgotten doses, or we've saved them for the next time that we get sick, which is not okay to do, because then you have problems where you run into super bugs, is what they are called, and which basically that means that these viruses, not viruses, because viruses you don't treat with antibiotics, but bacteria that is in your system, when you take the antibiotic, it's destroying those to get rid of them. When you stop taking the antibiotic before the complete course, there are some of that bacteria that's still living in there, and it reforms, and then it makes it resistant to the antibiotic the next time you take it. And then you get those superbugs, which are your MRSA, your VRE, and then there's actually a couple other ones that I learned during this process. Extended spectrum beta lactamases, and then there's also a penicillin-resistant streptococcus, which are two more that you don't commonly hear. You hear the MRSA and the VRE more common, and with those, it destroys, with the MRSA, that's the strep. It's a strep bacteria that then grows, and then when you take the medication, it doesn't work. It's not effective towards it, and then it's harder to get an antibiotic. And most of the time, what they'll go to is vancomycin, because it's very strong. And then you do the vancomycin, you don't take it as prescribed, and then you're resistant to vancomycin. And from that point on, it's very hard to treat. Some things that you can do to prevent becoming resistant is washing your hands. A lot of these are hospitalized. Hospitals are really bad with carrying on MRSA, not treating it, getting MRSA in the hospital because of improper hand washing. Some other things, according to the CDC's website, an antibiotic is defined as a drug that fights infections caused by bacteria. The first antibiotic was discovered by Alexander Fleming in 1927, and that was penicillin. And now we have people in that short 1927 really wasn't that long ago that we discovered antibiotics, and then it was 20 years later that they actually started being used, and so that's really not that long ago. And we already now today have people that are resistant to penicillin. Let's see here. On our little sheet here, it tells you, and something else that some people do as part of stopping their antibiotic regimen is something that is a side effect versus an allergic reaction. Those two things are not understood by the general public, because an allergic reaction would be your hives and itchiness. Diarrhea is not a reason to stop an antibiotic, because antibiotics cause diarrhea. Unless it's severe, you need to continue taking it. That's more of a side effect versus a reaction. Let's see what else on here. And then something else that's being done is doctors are over prescribing antibiotics. They give them for the common cold, for bronchitis, and that stuff is not treatable with an antibiotic. It just needs to run its course. But doctors do it for two reasons. They feel that their patient wants the antibiotic, and they feel that they're also that they're giving the wrong diagnosis. And they feel if they give an antibiotic, then that decreases their risk of error. So basically, don't stop don't stop taking your antibiotics. Take them for the full prescribed amount of time. Don't skip doses. Follow the directions, and if it's not effective, go back to your doctor and have your doctor prescribe you something that will be effective. Don't treat yourself. If something needs to be treated with an antibiotic, you need to follow your doctor's guidance with it to prevent getting really sick and not being able to be treated by various antibiotics. Do you guys have any questions?
Thank you.
Thank you.
I stand for